What are the benefits of a stretch and a sweep by a midwife at the end of your pregnancy to try and induce labour? But also, what are the benefits of an induction of labour? Now, this is worth a watch and a save if you are having a baby. Now, there can be many benefits to induction of labour. Now, this is going to depend on your own personal circumstances in terms of medical, social, obstetric, pregnancy history. For example, if you've got preeclampsia, it's a way of ending the pregnancy safely without putting the mother's health at greater risk, for example, in relation to her kidneys, her liver, to the blood pressure, to the strain on the heart, for example. So preeclampsia has a really good indication for commencing an induction of labour when the pregnancy is at a safe gestation to do so. It can also be a social aspect as well. For some women who maybe have military husbands, that actually they're being deployed, sometimes there is a social benefit to an induction of labour so that they can spend some time together as a family, for example, as well. And for other women, it can be a mental health perspective as well. So maybe reduced anxiety about going post-dates, for example. Maybe it's that the pregnancy is causing a lot of symptoms that the woman is feeling mentally unable to cope with anymore. So once the pregnancy gets to a safe gestation, and this is anywhere from about 39 to 41 weeks is the average time for an induction of labour to commence. Now, this sometimes is earlier depending on how many risk factors there are, how many other complications there are of pregnancy, etc., other blood profiles, medications that the woman might be on. But 39 weeks onwards is usually the safer time to commence an induction if an induction of labour is going to happen. The earlier, the higher the chance of respiratory problems, increasing the chance of a baby going to a neonatal unit, which is why it's not recommended usually before 39 weeks, unless there is a clear medical indication where the risks of continuing a pregnancy past that point far outweighs the greater good, for example. So a stretch and sweep where the midwife digitally enters her fingers into the vagina, through to the cervix, and trying to sweep the membranes off at the top of the baby's head to stimulate prostaglandin release and to try and trigger labour, but also so that that baby's head presses more on the cervix as well, trying to stimulate those labour hormones and the labour reflexes as well. Now, this is usually offered in the UK to first-time mums from 40 weeks and to second-time mums from 41 weeks. Now, sometimes this can be brought earlier, depending on local guidelines and also depending on your own medical history. For lots of women who are maybe having an induction of labour much earlier than 39 weeks, for example, or 36 or 37, 38 weeks, they will usually be offered a stretch and sweep prior to a medical induction of labour happening. Now, whilst a stretch and sweep isn't formally counted as an induction of labour from an NHS statistic perspective, it is an induction of labour. It is trying to trigger labour earlier than it would have naturally started itself. Now, the benefits are that it might reduce the chance of a medical induction, so this is anything from prostaglandins, breaking waters, hormone drip, for example, in 3 out of 4 women having their first baby. So a woman having a stretch and sweep at 40 weeks with their first baby, it may reduce the chance of a medical induction in 3 out of 4 of those women. In a second time plus mum, so anyone who's had babies before, this is much more beneficial. So actually it may reduce the chance of a medical induction in 4 out of 5 women, for example. So it's much more effective in mums who've had babies before. Now, from the data that we have, 79% of women will go into labour within 1 week of having a stretch and sweep, and it may decrease the length of pregnancy by about 1 to 4 days on average. Now, if you have more than one stretch and sweep, this was found to be no more effective at reducing the chance of medical induction. Actually, women who have more than one stretch and sweep are no more likely to go into spontaneous labour than the women who have one stretch and sweep. Now, you may be asking why, and that's because actually all the evidence and research that looks at stretch and sweep looks at women who are between 40 and 41 weeks on average. Now, 50% of women will spontaneously go into labour after 41 completed weeks. So actually we know that women, regardless of the stretch and sweep, are more likely to go into labour after 41 weeks, therefore saying the statistics that we provide might be slightly flawed because actually we are performing these stretch and sweeps at a time that women are more likely to go into labour themselves. And so did the stretch and sweep actually trigger the labour, or was the woman likely to go into labour herself from the research perspective? And that's something that we cannot answer, sadly. And from all the evidence that exists, there are no differences in caesarean births, instrumental births, or reducing other adverse outcomes for either women or birthing people or babies if they choose a membrane sweep or not. So actually, a stretch and sweep doesn't reduce the chance of a woman having a caesarean birth or an instrumental birth. It just changes the chance of a woman starting the medical induction process. And the main risk of a stretch and sweep is firstly that it can't be performed because actually if the cervix is closed A midwife can't actually push her finger through. And of course, we have to be aware that pain and discomfort is also more likely with a stretch and sweep as well for women. 63% of women report moderate discomfort. Now, stretch and sweeps can potentially be done with gas and air if you're in a unit having a stretch and sweep, for example. There's also an increased chance of vaginal bleeding. The cervix is very vascular. When you touch it, when you move around, when you're doing a membrane sweep, sometimes it can bleed. And that is quite a common side effect. And sometimes that will also mean that you'll need to go into a unit, have monitoring and be observed as well for some time, potentially then triggering an induction of labour as a result. There's an increased chance of infection. Any vaginal examination that's undertaken, you're moving bacteria that's naturally on the outside of the vagina, regardless of how clean your gloves are or aren't, and you're moving it from the outside of your vagina onto the inside. And as a result, that can increase the chance of infection for women. There's also an increased chance of long spurious onset of labour. So these are these early prodromal labours that start, stop. Essentially, what we've done is we've tried to stimulate the hormones, and if the body and the baby's ready, great, it's more likely to work. But if we've kind of stimulated some of the hormones, kind of irritated the uterus, pushed the baby onto the cervix, then that's what can cause that on-off on the cervix, and sometimes that start-stop labour. For some women, it can increase the chance of that long, early, latent phase of labour. And if a stretch and sweep is done when a woman is in labour or with contractions, now this should never be done without your informed consent. But there is about a 9% chance of waters breaking. That's because actually if we're doing a stretch and sweep and the membranes, the bag of waters, is bulging, it's like popping a balloon. And so sometimes they can go on those terms. And that can also increase the chance of infection as a result. As always, I highly recommend Sarah Wickham's Inducing Labour book so that you can make a fully informed choice about all the risks and all the benefits of any induction of labour method.